Today we'll take a look at the knee. We're going to take a look at the different muscles surrounding the knee, um, how they could potentially cause pain if there's any imbalances in them. We're also going to take a look at how the knee works, as well as how to strengthen the surrounding tissue on the knee. All right. Now, first things first, we'll take a look at the muscles of the thigh. Now, this model does not have all the muscles I will be discussing, but I will show you just um, approximately where they are all located on here. Otherwise, I'll just use my own leg as a model. All right. So the first group is the group of the thigh, or your quads, as you know it, for those of you who are gym rats. So the muscles of the thigh, or the quadriceps as they call it, of course there's four, consist of the big thick one here at the top. That is called your rectus femoris. All right. Then on the medial part, or on the inside of the leg, you have your vastus medialis, so medial is inside. On the outside, you have your vastus lateralis, lateral, on the outside of the thigh. And then underneath the rectus femoris over here, you will have your vastus intermedius. Okay, now here it can't be seen, but if you chop the thigh in half and you look there, you can see that there. Now, just for a little bit more of an in-depth look, your muscle compartments here, as you can see, these little lines here is all part of your muscle compartments. These big lines over here is called fascia. All right, and that sends feedback from one muscle to the other one. Now, in future live streams, we will discuss the fascia a little bit more, but I will touch on it today a little bit. All right, now at the back of the leg here, you have what is commonly known as your hamstring group. Okay, that is called your biceps femoris, not as in biceps here, but bicep as in double muscle here at the back of your thigh, biceps femoris. Then you have your, in the inside here, again on the medial side, you have your semimembranosus, your semitendinosus, just slightly above it. And those all in conjunction with the muscles on the front anterior part, these are posterior, anterior front, posterior back, all attached to your hip. Actually, they originate from your hip, but they're attached down here. Now, speaking of the hip, there will be exercises discussing the muscles of the hip, but because they originate in the hip, I'm not going to go too in depth on that because there is sites on the pubic bone that we need to discuss. All right. Now, getting back to the anterior part, the vastus group, these all attach down here. All right. So you got your femur, which is your thigh bone, and your tibia, which is your shin bone. And then here next to your tibia, you have your fibula, this thin bone over here. All right. Now, this quadriceps group, or the vastus group, all attach around the tibial tuberosity, which is this protuberance here, all right, and your patellar ligament, which is this one here. All right. Then further down on the tibia, on the front of the shin bone, just for interesting, you have your tibialis anterior, which for knee health also needs to be strong in a certain degree, or you need to start paying attention to it later in life, especially if you want to avoid suffering from arthritic pain and so forth. All right. Then sticking with the lower leg, we're going to go back to the posterior. Sorry, I'm jumping around a little bit. And at the back here, I don't have them on the model, is your what's called your triceps surae, or your gastrocnemius, or your calf muscle, as it's more commonly known. Okay. Underneath it, that's your soleus. All right. Now, your soleus and your gastrocnemius have to be strong as well for knee health. So to keep your knees strong and to keep the muscles in equilibrium, you gotta work the whole leg with compound movements. to keep the knee joint strong, especially if you have already existing knee problems. Now, speaking of which, we're going to go back to the front, to the anterior part, and as you can see here, you got your patellar ligament. Now, if you play sports, or you don't necessarily have to be active, you can just be a desk jockey and sit a lot, your muscles here of the thigh will tighten up, especially at the top. These in turn will pull on this patellar ligament, which can lead to knee pain. Okay, so it is very, very important that you keep balance between the front and the back, anterior and posterior. So the hamstring group, or biceps femoris, semitendinosus and semimembranosus, which is hamstring group, and the quadriceps group, or the front of the thigh, the vastus group, as well as the rectus femoris, have to be trained either together or individually, but have to be even. So you can't have one that is strong and one that is weak. Otherwise, that can, or in fact, it will lead to knee pain. All right. Now, going back to the ligaments, we'll go back to posterior. Of course, it's just easier to see. Okay, let's actually go to medial first. So medial inside of the leg. So you will see here, you've got this ligament here to stabilize your knee. Okay, that is your MCL, or your medial cruciate ligament. Okay. On the opposite side, on the lateral side, on the outside of the thigh, you have your LCL, or your lateral cruciate ligament. Sorry, this is medial, this is lateral. I got it the other way around. Pardon me. And then at the back, you have your ACL over here. This is a common one you've seen before that gets that can get damaged or torn, completely torn off, especially in heavy contact sports such as rugby. You even see it in soccer or football. Sorry for the Brits out there. And then you got the posterior cruciate ligament here, usually tiny, a little bit stronger. Now, the weakest ones in these structures is normally the LCL and the LCL and the MCL, mainly because of them being vulnerable from outside forces, from the outside to the inside, or from the inside to the outside, such as contact sports like judo can definitely damage these two as well, where there's you try and get your opponent's feet out from under him. And then for the posterior cruciate ligament really to get damaged, it's you have to have a lot of force from anterior, from the front. All right. Now, looking at the knee here, again, medial this side, lateral on this side. You also have your menisci. Okay, so if you look at the thigh bone over here from the back, you have two condyles here, and on the tibia, or the shin bone, you have your epicondyles. All right. Now between them, there's cushioning. All right. That if you bend the knee there, everyone can look in there. You have these two cushions over here. These are your menisci. Now, as you age, and especially with deconditioning, if you don't stay active, these menisci, because of that muscle imbalances, can take a lot of force, and then if you become arthritic for some reason, or just through sheer wear and tear, they become really, really vulnerable to tears. They are also vulnerable to external forces, but mainly it's because cushioning gets worn out over time. They can get tears. Now, as discussed in previous live streams, I told you that you get 3 different tears. You get your first grade, second grade, your third grade. Third grade being completely torn, second grade slight tear, and then first grade is kind of like a mini tear with or strain. Okay, so that is mostly all the muscles and ligaments and tendons and bones surrounding the knee joint. Before I forget, you also have your kneecap over here. The ligament is over that. That's called your patella. Okay, it's your actual kneecap that can slide up and down as you either extend your knee or flex your knee. Okay, flexion, bringing your heel to your butt. Extension, straightening your leg. Okay, flexion, bend. Extension, straight. Okay. Now, so coming back to muscle imbalances. So if for instance your legs become deconditioned, mainly because you just working all day, don't have time for sports, or don't make time for any sports or recreational activity or any gym work, what happens a lot of time is with prolonged sitting, this rectus femoris, the rec fem as it's also called, in conjunction with your hip flexors become extremely super tight, and then the vastus medialis, the inside thigh muscle from on the front here, becomes really weak. In certain instances, it can start to atrophy a little bit, which means the muscle becomes completely deconditioned. There's no strength in them, and the vastus lateralis has to do all the work. And you see this not just in deconditioning, but also in certain injuries as well. Say where there's a partial tear in your medial meniscus, this little cushion we talked about, then you'll have very, very tight abductors, or the outside thigh muscle, which is your vastus lateralis. And also, as discussed in previous webinars, your iliotibial tract, or iliotibial band, or IT band as it most commonly known is, which is kind of almost like a combination between a ligament and a muscle. It's really, really taut and tight, all right? And mostly to get that loose, you need to go for some deep tissue treatment or massage that's really vigorous to iron out any adhesions, which is knots or kinks in the muscle fascia. All right, you can either do that through massage, like I said, or with a foam roller. Nowadays, as you can see in the back, we have loads of tools, massage guns to get rid of all those kinks and increase blood flow to that area. And then you need to strengthen the medial muscle, the one that is atrophying. How do we do that? All right. Basically, by trying to keep the leg into extension and slightly rotating in, and then just looking for the muscle firing there. But it is tough because they have to work in conjunction with the rectus femoris, which in turn you have to keep loose as well, while after you've loosened up the fascia surrounding the outside of your thigh. Okay, so so that's what happens in a lot of knee problems, not just weakness, but injuries as well. So the abductors, or the outside muscles, become very, very taut. The inside muscles become very, very weak. Now, coming to the lower leg, you have your gastrocnemius, or your calf muscle, and then obviously your soleus. Now, regarding these, the gastroc itself, so if you look at my lower leg here, has to be kept strong, which is actually pretty easy, to be fair. You can just do calf raises with your hands against a wall. If you don't have if you don't have any additional external weight, you can just add repetitions, or you can do it on a step where you can get a full stretch and then full contraction of the triceps surae, aka the gastrocnemius, aka the calf muscle. Okay, now the soleus below this over time, especially from prolonged sitting and inactivity, can become very, very tight. This is sometimes a problem because we do encounter patients that you realize there's a lot of wear and tear on their knee. They've got the crepitus, the noise, the Rice Krispie sound in their knees, and they are weak. And then you start going to work on the thigh. You loosen everything up. You strengthen everything in the thigh that needs to be strengthened, but still, there's still pain. And then you realize when you come to your more weight-bearing compound movement that this soleus muscle is very, very tight. Now, when we discuss the lower leg in future videos, I will show you how to loosen this up properly through, again, massage or myofascial release, or certain stretches or mobility drills, which is even better. But loosening this up also does wonders to knee pain. All right, so it's something to keep in mind for future references. Now, we can go ahead and I'll show you some basic exercises. If you recently injured your knee joint or you are currently suffering from knee pain, I'm just going to put this model aside because it will just fall over if it's over there. So I'm just going to park it there at the back. So if you're currently suffering from knee pain or you have currently a knee condition, then we'll look at some basic exercises to get you started. All right, but it's these are very basic, so they are very safe, but it is always better, disclaimer warning, to go get everything diagnosed first and then start off with these things, or ask your therapist or the doctor you're seeing whether, or any clinician you're seeing at that point, whether these exercises is right for you, which they should be. But like I said, always better get a thorough diagnosis, even a scan if you need to. Okay, and remember, pain management just as important. Okay, so without further ado, all right, so I'm going to do both knees. So regardless of whether the you injured the left or the right leg, one thing you can do is you can have a seat with your hands behind you, or you can sit with your back supported against something. All right, and what you can do is, now if you have an injured knee joint, a lot of the times, depending on the injury, but most of the time, you will have trouble getting your thighs or that quad muscle we discussed earlier to fire up, to work. Okay, so what you're going to do is you're going to try and push the back of the knee into the floor, and then you're going to look for muscle contractions on your thigh. All right, if the injury is not that severe, you can even try and push the back of the knee down into the surface below you, whether that's on the couch, on the bed, or on the floor, and then try and lift the leg up. Okay, same with the other side. All right, you can lift that low. Start with 10 repetitions. When you get to around 25 repetitions, it's always better to put something under the knee, like a rolled up towel. If you already have a foam roller, you can put that under the knee and you can start doing flexion that way. Okay? But for now, just activating the thighs, very important, because why? Of that weak vastus medialis muscle on the inside of the thigh. Okay? Now, next exercise, we're going to move a little bit more up. Now, it is very important for knee health to keep the muscles of the hip, especially the glutes, your backside, to keep them strong, especially on the outside of your glute, on this side, all right? Because it keeps a lot of pressure off things down here, especially regarding your iliotibial tract, which tightens up, discussed earlier, in a lot of knee conditions and injuries, okay? So the best way to do that is to do it the classic Jane Fonda style, to lie on your side, all right? And for those guys out there that think these are, for sissies, don't think that, because these are actually pretty brutal after a few repetitions if you do them correctly. So you're on your side and you want to keep the bottom knee flexed, okay? It's just to keep it out of the way, all right? And it's also just so your hip doesn't roll back. Even better if you feel you're really unstable, especially if you're doing this on the bed first thing in the morning, then just move your back until it's against something like a stack of pillows behind you or the wall. Even better if you're doing it on the floor. All right, and all you're going to do is you're going to lift the leg up and down without moving the hip here. So keep this hand in front of you holding, and you lift it up slowly. You'll see when you get to 10 or 20 repetitions, things will really start burning here on the outside of your butt. All right, that's a good thing. Just keep it working. The reason why it cramps up so quickly, this muscle, the gluteus medius, which you need to keep strong here, which we will touch on when we get to the hip, it's really small, so it's about generally the size of a fillet, and then so it just does cramp up very quickly. But as soon as they're strong, they could keep a lot of pressure off the outside of your thigh. All right. Now, for the opposite leg and then the inside, you are basically going to bend the top leg. Just put it here so you can give this one a bit of a stretch because it worked really, really hard. You can push down here, or you can give it a hug, or you can just keep your hand where it was. And then you're going to use your inner thigh without lifting your upper body. A lot of people who are weak in the inner thighs or the adductors, again, which will be discussed in a future live stream, will move the upper body when they lift the inner thigh. So try not to, even if you just do small movements in the beginning and then gradually, as you get stronger, more mobile, lift higher. Very, very important to keep the inside here strong, inner thigh, especially when your vastus medialis is very, very weak and you have trouble when you do your leg extensions to keep it firing and keep it activated. Okay, so that basically covers anterior, medial, and lateral. So you started out with lateral when I was facing you guys, and then you went the opposite leg to medial on the inside. So obviously you got to flip around, and you obviously have to do the whole caboodle, yeah, on the other side. Okay, same as before. All right, same repetitions. Okay, and always start with your weak side. Now, for the back, for the biceps femoris, semitendinosus, semimembranosus, aka the hamstring group. Okay, the best one is the classic glute bridge. Okay, I like to do it with my feet flexed, lifting my hips up. All right, because it hits my glute max, which is the big muscles on your backside. It just hits it so much harder, and your hamstring group tends to fire up really, really well, especially here on the origin point. Okay, so so this one you can do loads of reps of it. You can also do it for isometric hold. So lift up without moving the hip. You can hold, lift one up, and then the other one up. That's a little bit more advanced. Okay. Now, if your knee is very painful with these, which it might be because your quad group might be very, very stiff, and you can just lift it here. Yeah, you can make the movement smaller, but also for mobility and more hamstring activation, you can also do it lying flat in your front like this. Keep your head down so you're not using your lower back too much, okay? Keep your chin up, your head down, and your ribs down. Separate your feet slightly, and whichever leg is affected, you're going to lift up off the floor without letting your lower back kick in. So if you're only lifting a few inches, that's fine. As your mobility improves, you can lift higher. And then you're going to bend that knee and straighten. If the hamstring's weak, it's going to cramp up. So you might have to take breaks between reps and give your hamstrings just a gentle bit of a stretch. Okay, but I personally like that one because it's a classic example of reciprocal inhibition, where you strengthening your agonist and then lengthening your antagonist. Okay, so you getting lengthening and strengthening at the same time, depending on your plane of movement. All right, so I think that pretty much covers it. If you have any questions, please post them now. I try to make this as painless as possible and not too technical. I know there will probably be healthcare workers out there just brushing up on this stuff. So I hope this helps. Next time we will be looking at the back. The back is a little bit more technical, so it might take a little bit longer. So tune in for that one. It's definitely an interesting one. And yeah, if there's any questions, please let me know. My webinar on the knee is today. So 4 o'clock, if you have time, please tune in for that one. We will be going over pain management for the knee, which is crucial. All right, we'll touch on a little bit of this, but not so much because this is basically all covered over here. And so join me for that one, so you can learn more about your options for pain management wherever you are in this world. It doesn't matter whether you're local here in Singapore or whether you live in Australia or New Zealand or somewhere else in the southern hemisphere, please tune in. My northern hemisphere friends as well, please tune in. And we'll give you some options when it comes to managing your pain on your own, especially if you live in rural areas. All right. Now, any questions so far? Not yet. Yeah, please like and subscribe to this if you are watching, and we will. I will definitely. This will be a weekly thing. So next week we'll cover the back, and don't forget to like and subscribe to our other social media as well. And I hope you enjoyed this one as much as I did, and hope to see you soon. Have a great day.